here we are. This is Sex Love Psychedelics, and I'm your host, Dr. Kat, bringing you psychosexual conversations that will leave you intellectually turned on and hungry for more.
And yet, there is this question of how, long-term antidepressant use. I think there's so many people who've been on it for 5+ years, and how is that impacting our internal chemical makeup?
Yeah, that's a great question, and not something that there's very much information on. It's like, what is the long-term use? And I mean, major depression as an illness, before they had antidepressants, they would just study major depression. And it seems like most times, you can have consistent chronic depression, but most times major depression is episodic. That's why they call it a major depressive episode. And the diagnosis is to diagnose like a major depressive episode, like 5 out of 9 in the last couple of weeks. And the sort of typical length of a major depressive episode was somewhere between 8 and 12 months. So you have antidepressants, it's sort of if you look at the prescribing guidelines, it's like, okay, well, yeah, there's the delay to efficacy. But once a person feels better on an antidepressant, it depends which illness you're talking about. They have slightly different durations that are recommended, but it's usually well, you should continue them on whatever dose that made them feel better for at least 6 months, and probably more like 9 to 12 months. So it's almost like a course of antidepressant therapy, I think, is ideally somewhere between 9 and 18 months long overall. Okay. And it's meant to sort of treat this episode. So this is another thing, is sort of okay, if you want to take antidepressants, be prepared to commit to it. Be prepared to commit to it for a number of months, if not a year, because it's probably not going to do you that great to take an antidepressant for a couple of months, start to feel better, and then be like, oh, I feel better, and I'm going to stop again. It's just not, this is not the ideal way to use them. But they cause this physical dependence. So a lot of people will, 12 to 18 months, yeah, I'm feeling much better. Can I stop it now? And then they go to try to stop it, and they run into this withdrawal syndrome, and they just kind of get stuck on it. And that's it, is well, depression and anxiety is epidemic. There's more people that have that than ever before. There's more people on these antidepressants than ever before. And the number of long-term users just seems to continue increasing. So, I don't know what to conclude out of that, because it's all observational, right? You might conclude that antidepressants, and particularly long-term antidepressant use, isn't that effective. Or you could conclude that the world is just getting worse and worse and worse, and that's why people are feeling this way, right? Or maybe it's 6 of one and half a dozen of the other. I'm not sure.
Yeah, and I don't know that there is a conclusion. And I think that's one thing that I appreciate about this entire episode, of how you're able to hold both of those, all these perspectives at one time, versus so often I see, people on one camp or the other pitting their truth with a capital T against the other and saying that they have the answer. But here you're saying it's not, you're not demonizing psychotropic medications, and you're not, or psychedelics, but there's a space and a place for all of it. It's just educating ourselves the best that we can, so that we can discern for ourselves what
That's right. Right. And that's why that's kind of why I quit traditional mental health settings, because I felt like I couldn't talk about psychedelics with people, and I felt like that was like practicing medicine with one hand tied behind your back, which I get that the drug, most of them are illegal, but that felt unethical to know about these other options that could be helpful. And they're saying, please, what is there? What else is there out there? And you're kind of like, well, this hospital gets paid by the federal government and insurance, so I better not bring up psychedelics to them. And so man, that just doesn't really feel like I'm doing people right with that kind of thing. But yeah, it's there's a few different reasons I named spirit pharmacist, but one of them was basically an acknowledgement that each person has something unique that is going to make them happy. And I'm not really sure which one of those, and maybe not happy, but at least not depressed, perhaps. And it's their quest to find what that thing is. And it's not my job to tell people what that thing is. My job is to sort of tell them well, this is how you use one group of tools and you can try those. This is another group of tools and you could try those. It just so happens that I sit in a position where most people have tried all the traditional tools or many of the traditional tools and are sort of disenchanted with it, right? So it's sort of like, hey, if you wave a banner out there on the internet that says something about like, tapering medications or psychotropics, then you tend to meet a lot of people that are very disenchanted and want to go in the direction of psychedelics. And obviously I am kind of an enthusiast around, psychedelics, and, I'm bullish on their medical potential and things like that. But yeah, that's just it, is like, I just want people to feel empowered to make the best decision for their health and to feel like they know what they're doing, and to feel like that at the very least that they know what they're doing is safe. Whether it works or not, frankly, there's just a little bit of experimentation and exploration that persons are going to have to do. And I think that's true even with traditional sorts of medications. I hear a lot of people, I'm so tired of being the guinea pig. It's kind of like, don't they just know what to give me? And it's like, no, they don't know what to give you, right?
Yeah.
Your job to find it, right? And okay, they're there to guide you, right? That they have some knowledge about these things, but like, ask why. Push back, why this dose? Do I need to start? Oh, I looked it up. This is not like the standard starting dose, or this is half the standard starting dose. Why? Like people should be questioning the rationale behind things a lot. And yeah,
we want a savior. I see that a lot. We want the answer, the savior, heal me now.
Right.
But it is a process and experimentation, and we do have to empower ourselves to do the research.
Well, that was fun. Thanks for tuning in, lovers. And if you want to experience more ecstasy and sexual liberation, head over to sexlovepsychedelics.com and learn about how you can join me for any one of my online or live events. And while you're there, grab my free guide on sex and psychedelics. Remember, this podcast is for entertainment and educational purposes only. Please contact your healthcare provider and local law before pursuing any of the products or psychedelics discussed. And one final note here. I make this show specifically for you. If you're loving the show, then be sure to leave me a review in iTunes or Spotify to let me know. Happy to be here and happy to serve. I'll see you next time on Sex Love Psychedelics.